Are your energies too strong for the wires? Okay. Our next speaker deserves your attention. Our next speaker has probably gotten a little tired of me bugging him for the last several years about when you're going to be ready, when you're going to be ready, when you're going to be ready to show it to us. Well, I was thrilled last spring when he said, I think I'll probably be ready by August this year. This is something that, to me, is probably one of the most exciting developments that's been launched at our conference in all of our time. I am pleased to introduce to you Dr. Bart Flick of Lakemont, Georgia, who's been working on this project for many, many years with many, many dollars and much frustration and patience and everything that had to be involved in the development of the Silver Lawn Bandage. To me, and what little I know so far, it's enormously exciting, and I think it ought to be in every hospital and clinic and doctor's office in the world, not just here. And I know Dr. Bart feels the sense of urgency as well, that something like this can be of help. And we're more than pleased, really honored that he has chosen this to be the official launching of the Silver Lawn Bandage. And I know you're going to enjoy very much hearing Dr. Bart Flick, orthopedic surgeon from Lakemont, Georgia. And here he is.
Well, thank you all. It's a pleasure to be here. This is our first really public presentation of this product, which it has been approved by the FDA in multiple different aspects. So I wasn't going to launch this product till later this fall, but I think with the urgency of the times and things that are changing, it would be important to put it out now. This, by introduction, I'm a member or a fellow of the American Academy of Orthopedic Surgery and also a fellow of the American Academy of Wound Management. These are just dog licenses to give myself some credence that what I say may be correct and may be true. We're going to take you on a trip through the development of this wound care product. Silver is all familiar to you, and I added the last phrase last night after the talk. And I assume that it probably is familiar to people outside this planetary system. Silver is, as I say, everybody knows what it's a relatively rare element. We'll just go over some basic facts here. It's 63rd in order of abundance on the Earth. It's found in many ores. Melting point is 961 degrees centigrade. Silver does an interesting thing when you get about 10 degrees prior to its melting point. It releases a huge quantity of oxygen. And the metal smelters call it burping. And it's when you see silver in a molten state going from a solid to a liquid, it'll belch out these large bubbles. And that's one of the reasons how this product works and how silver works. Silver goes to an oxide state, and the oxide state comes off the material, whether it's a colloid or whether it's this fabric, and then separates into a silver ion into a hydroxyl ion. And again, the boiling point is well above anything we would ever consider. Argentite and silver sulfide are the primary compounds. The sulfide is important because you'll see how it interacts in the body. I added the diagram on the left, the dumbbell, because I think this is probably the most accurate energetic drawing, drawn about 1904, of what the silver molecule looked like to Leadbeater and Besant when they were viewing the elements clairvoyantly. Interesting shape, and this was a chart that, of the many different periodic charts I could have put up just to show you where silver is, this is the one I like the best. It's not the standard, of course. Silver's right in the middle. It's in a group called the dumbbell group, which has a very specific quark configuration. If you look at her particles, they all line up with the particles that are out today in subatomic physics or subatomic particle physics. History of silver, very briefly, it has a long, long history in mythology and vampires, witches, ghosts. It seemed to have magical properties. And the magical properties were probably due to its antimicrobial aspect and also due to the fact that it stimulates wound healing and it stimulates tissue regeneration at certain levels if you present it to the body in the right form. Cyrus the Great, one of my old heroes of the past, used it for carrying drinking water in large silver vessels to keep the bacteria content down. And eating utensils, surgical instruments, silver. There was one interesting theory that someone thought that the nobility back 100,000 years ago had used silverware and actually took on quite a large body burden of silver, and in the process their skin had a grayish discoloration, what we call today argyrosis, which is somebody who takes too much silver, but gave them a certain degree of immunity. So perhaps that's true, perhaps it's not true. The last 200 years, silver has come in primarily in the silver nitrate form. It was used for healing skin ulcers, compound fractures, that's an open fracture. And it was also used as a 1% solution for gonorrhea of the eye that a baby would get as it comes through the birth canal in a mother who was infected with gonorrhea. I've seen these cases in India. It's a terrible blinding disease in a child, and a few drops of silver nitrate in the eye, 1% solution, literally kills the gonorrhea species and prevents a lifetime of blindness for the child. And silver wire sutures, this was down in Alabama. A fellow figured out a very difficult repair. This was repair of a hole, essentially, between the bowel and the vagina, a very high source of bacteria, very low success rate, where he closed this, used silver sutures, and reported in the medical literature about 1852. This was the first silver wound dressing was made by this fellow named William Halstead. William Halstead was the head physician at Johns Hopkins Hospital between 1890 and 1920. A friend of mine told me a story about William Halstead. This is the fellow who invented the surgical glove because he felt sorry for his nurse because she didn't want to get blood on her hands at surgery. So he developed a latex or rubber glove at that time. And in the same article in 1913 where he reported use of the silver dressing, he also reported the use of the silver glove. William Halstead was a man with an overactive mind. His downfall, interesting enough, was cocaine. He was a physician around the 1910, 1920s who became a cocaine addict, and really from about 1920 on his productivity went down rapidly. But he served a purpose and he performed a good job. Okay, everybody knows what a silver colloid is. When I went through the silver colloid literature, there are a tremendous number of misstatements, and I'll go over a couple of those and try to give you some facts which I can back up with data. But the colloids got started around the turn of the century by a fellow named Elbert Barnes. He was a physician who developed a product called arginol, which was a silver protein compound. He took the profits from this product and went to Europe in 1912, between 1912 and 1915, and bought the greatest art collections in Europe and brought them back, and they reside in a private collection in Philadelphia today. And that was from his fortune. He had $10 million in sales in 1910, which would be like Glaxo and Pfizer put together today as far as the total income. This was a very successful product. And this is the product that allows the people today to sell silver colloids, because it was in existence prior to the existence of the FDA, so they got through what they call a loop in the grandfather clause, which brought this product into creation. The FDA has a very they really are not taking much a stance on silver colloids despite what you may have heard. I've talked to the folks at the drug evaluation section, and the one woman a physician wrote an article about 5 years ago on the pluses and the minuses of silver colloids can't be found right now, and nobody remembers her at the drug evaluation section of the FDA. The FDA really is not that concerned about silver colloids. The amount of silver you would actually take in your body would be, give you a relative scale, would be 20 micrograms per dose. When you eat a good serving of mushrooms, you're eating about 150 to 400 micrograms. So the dose you get in silver and silver colloids is so low that the chances that somebody would develop overload of silver and develop a disease called argyrosis is almost non-existent. The claims of silver colloids, a lot of the claims are unsubstantiated. A lot of the articles start out with referring to a Science Digest article where it says over 500 species of bacteria have been tested. Well, that's absolutely unfounded. I went through the literature and spent years doing this, and literally, I came up with 54 species of bacteria that's reported in the medical literature worldwide, not 500. I'm going to go back and find that Science Digest article, but it's totally unsubstantiated. That doesn't say it doesn't work. It's a wonderful product, but it just says that the claims are not real. The original colloids were used for mucous membrane problems, whether it was nasal, whether it was in your throat, whether it was vaginal. It was used as a topical. People did take it orally, but the primary use was eye drops, nose drops, gargles and sprays and douches. Okay. Now, what can this product do? You can take an injury like this, and you'll see this case later. This is a foot of a 2-year-old child came to see me with this is 6 days out because the skin had sloughed by this point, and you're looking at a partial thickness burn. Child came in and we put the dressing on the child. This was within half an hour after the child was burned, and the child was screaming hysterically. Within 20 minutes, the child was sound asleep. And I'll show you why. This product takes away pain. And hopefully by the time this lecture is done, you'll know why. And this is what we end up with. We end up with a foot that's just about normal. This is 235 days later. The dressings were applied for about 15 days. This is something that you could do. Now, I'm not saying you should do this, because you have to take off the dead skin. You have to debride the wounds, and you have to do good wound care. But with the product you have in your hand was the same product, but configured in a dressing formation that healed this child's foot. And we'll go into why. Now, I'm from Georgia, and my road for the last 15 years I feel like these guys on the road. You do get run over many times, but you pick yourself up and you keep going. Okay, we're going to go over the story, the science, and some clinical cases. First, we're going to start with the story and some thoughts. Now, I do want you all to understand, this is my personal philosophy, that true healing is understanding and accepting the teaching of Spirit. One cannot develop forgiveness, and one cannot develop release of the trauma until you can get to the stage of understanding and accepting the malady or the physical problem that's come to you. But if you have a burn case and you're seeing somebody in the emergency room, they don't really care about that statement. What they care about is take away the pain. I want to get better. How long is it going to take? Will I ever be normal again? And all these things that fled through them. I learned everything about the development of this product from my patients. So I feel the clinic indeed is the greatest lab in the world. This was my teachings. So my story basically started in the late 70s. I went through lots of trials and errors, and it felt like over the last 15 years of putting together an airplane, not knowing if it was going to fly, taking risks, taking chances, putting configurations together. I know now why products don't get out there. Because it's too risky, it's too scary, you have too many threats from malpractice attorneys, you have too many threats from your colleagues. It's much, much easier to practice safe medicine, not medicine that pushes out the frontiers. This product pushes the frontiers out. Now, I had a good teacher in the beginning. I had a teacher who provided a great deal of inspiration to me and a great deal of courage. He was kind of a rebel and a cowboy, and he was my medical school advisor. His name was Bob Becker, who probably most of you all know he wrote a book called The Body Electric. When I met Bob, he was still in, you like that book, it's a good book. Bob was still in active practice. This is what he looked like when I was a medical student. He's about 84 now. He's retired. He would fight somebody for the truth. And when I was in my sort of dark days in medical school, not knowing really why I was there, I went to listen to a lecture by this fellow, by Bob Becker. I was a second-year medical student, and this was the first honest man I met in medical school. First man who was willing to tell me the way it was. And then I went over to his office, I knocked on his door, and I asked him if he'd be my advisor for medical school, and he said, "I hate medical students, go away." I said, "No, you don't understand. Look, I haven't found anybody who I like as much as you. Please," I begged him, and he said, okay, I'll be your advisor, but don't ask me anything. And I said, okay. Well, this was the first case that I saw. This was a motorcycle accident. This whole area is exposed bone. This is called an external fixator. This is an amputation material. You know, most people would say, you can't do anything with this. You know, you got too much bone exposed, you got too much infection, you can't do it. Well, Bob went on and developed a technique, and this was his technique that I later spun off of. He took the silver cloth, identical, although what you have is an improved process, put it in a wound, packed it in the wound, and ran a small generator. And his original system looked like this. We had a little electric generator. We put an electrode on the back of the leg. We put the silver cloth against the wound. We drove the ions from the cloth into the wound, and the wounds healed. They get sterilized, and then they healed. However, if you're going to an iontophoretic device, that puts you in a whole other category with the FDA. So when I realized I wanted to get a product out there on the market, I had to start developing a technology that didn't need the electricity. And we improved the plating quality, we improved the techniques, and the dressings we're doing now, they're not as good as this, but they're 90% as good as this technique. This takes a little while to load up. This was a paper that was published in October 1978. This was a leading article in the Journal of Bone and Joint Surgery, which was the premier journal in my field of endeavor. It's like the highest journal, the highest honor is to get into this journal. Bob had the first article in it. Now I bring this up that since 1978, October 1978, I was the only person in the country who had enough courage to continue with this process and develop it. Although this was in one of the leading journals. And I'll go into a little bit why things don't work. A little bit about this paper. He used the electrical technique. He had 15 patients come in who were in the study. 13 walked out with their legs. Most of these were Vietnam vets, some Korean vets who had large shrapnel wounds with chronic infections in their legs. A month after this, an article got published in the New England Journal of Medicine, which is our premier journal in medicine. And in there, they had this very complex fibular transplant graft procedure. It's a very expensive procedure. You take a bone from the other leg with its artery and vein attached to it, and you move it over to the leg that's infected. You cut out the piece of bone that's infected, and then you sew the artery and vein into the artery and vein of the existing leg. Very complex procedure. They were hitting 78% success, and that's about 83%. The difference is this procedure costs pennies compared to the other procedure, which was very, very expensive. At that time, would be about $25,000 for the procedure. So there was an economic incentive. Now, this is my teachings that I've realized why products don't get out on the market and the difficulty. They're economics of medicine and surgery. Someone has to take the risk to develop the product, to show that it works, and then once it works, then it has a chance of getting on the market. Physicians aren't willing to take risks. Introducing new concepts is very difficult in medicine. You can use the same format, but and the product would just be a has-been or a copy. But if you're trying to create a new paradigm, which we're trying to do with this product, it's very difficult to break new grounds. There are a lot of vested interests that don't want to see a product out. Not from the fact that this doesn't work, but from the fact they don't want to do research in this. We went to Harvard, gave a talk there, and the guy said, you got a great idea. This is great. But I'm not interested because this is not what I'm doing. And this is not part of what makes me famous. So they were not interested in picking up and helping us develop the technology. And a lot of economics. The product that you have in your hand is $1.6 million later to get to this point with the government approval, and we're right on the launch position right now. So it's like this product, when I started, was like, it was like alternative medicine. I mean, people thought we were crazy putting silver dressings in wounds and running the electricity through it. Now, people are less concerned now about electricity in the sense that they're using different types of stimulators for bone regeneration. But still, when you're when you create a new paradigm, the way to create the paradigm in 1999, 1998, is not starting out with the professional side. It's starting out with the across-the-counter side. Because you folks are the ones who accept things the fastest, with the least constipation of your thinking process. So these are my two favorite quotes. One was by Max Planck, the first one. And Max didn't mean this from a sabotage point of view. He just meant this from the point of view that the old generation has to die out before new concepts and new ideas come through. It takes time for people to change belief systems and thought systems. This last was my quote, because I love the concept that the more self-first, the selfishness that somebody has in research, the less their mind can expand into a new concept, a new idea. And you'll see what we're going to do with this dressing is we're going to create a new paradigm of why this works. It's more than just the silver, and we'll go into that. So I finished medical school, went on to the University of Vermont. 5 years later, I'm a chief resident there, and a fellow came to see me. Everybody said, cut this guy's leg off. You got to amputate it. It's not going to survive. Patient begged me, I'll do anything you want. So I said, look, when I was a medical student, I saw this technique. I'm willing to go back and do it. Well, this is what's involved when you start a new technique. You have to go to an IRB. They're called IRBs today, but at that time they're called human experimentation. This is a committee of your colleagues who evaluate the technology and see if it's safe. If you get IRB approval, then you can go ahead. Then I had to go out and build the generators, which was kind of an interesting experience. We built several different varieties of generators at the time. And I had to find a supplier for the cloth, which wasn't easy. I now know there are only 3 suppliers in the world. And you'll see some samples of the cloth, and I'll tell you a little about it at that time. And then I had to endure the skeptics. You know, I mean, I started on this case. They gave it to me because it was a throwaway case as far as they were concerned. This was the head orthopedic surgeons in the hospital. But they said, look, Flick, you want to do it, go for it. You know, it's not going to create any harm, and if you can save this guy's leg, fine. And here he is now. Earl wouldn't mind me showing his face, okay? I don't have any problem. Earl was a 52-year-old alcoholic, confirmed alcoholic, 4-pack-a-day smoker. As they say in medicine, had terrible protoplasm. And that was one of the reasons he didn't heal. He did have this injury, okay? This was a very difficult fracture, had a lot of hardware put in. And when you over-operate on a knee such as this with someone with such poor protoplasm, they're going to get infected. He got infected. And he ended up with an infected bone. Don't read this, but this just shows you he had 12 operations. He had skin grafts. He had bone transplants. You name it, he had it. So he comes to see me and begs me to do something. By the way, this is the swamp that was in his leg. These are the 5 bacterial species. Most people, when they have wound infections, they have 1 or 2 bacterial species. Again, this is an indication for amputation. If this is deep-seated in the bone, and it had spread throughout the whole bone, this is a bone scan. Every place you see black is a place where there's bone turnover. Where there's bone turnover in a high rate, there's probably an infection there. So they gave me the case. I took him. We cut a huge hole in this guy's leg. Now, take your leg. This is the whole width of his leg right now. Now, this was 12 days out, which is pretty amazing. But what I saw, every day when I looked at this wound, I saw tissue growing out of the bone. Now, that was unheard of. I'd never seen that before in a case this severe. We cut out the whole front 2/3 of this guy's bone, so he just had a back of the cortex of the bone left. But when I saw the tissue growing out of the bone, I knew I had something here. I knew this technique worked. And this technique could save this guy's leg. By this time, his leg is sterile. There's no bugs in his leg at all. We did cultures every day, and we had to follow certain protocols, which were quite demanding. This was day 53. Now, you say, well, that's a long time. It is a long time. This would have been healed now if he was anywhere nearly healthy or took any care of his health. But you see, the bone's totally covered now with tissue. Now, you could take this case, and you could do a skin graft, or you could do a flap, and it would survive. But he didn't want any more surgery at all. So we just kept with the silver. I finished residency. I went into private practice. The case hadn't healed. They agreed to continue healing it, and he went on to heal. He called me 3 weeks ago, which I thought was kind of interesting, let me know how he was doing. So I got married and moved to Georgia. I started my private practice. And believe me, that's where I live. I live where North Carolina, South Carolina, and Georgia meet. My wife wouldn't appreciate that, but it's real. So it's in the far right-hand corner is where I'm from. And I'm proud of it because it's a wonderful place to live. Okay, in my private practice, I've had many, many different types of lesions I treated with this product. And one of the fun things I want you all to do is you're probably going to find ways to use this product that I don't know. And we have a website, and we have a section on the website for sharing information and sharing cases. But literally, we've had everything from brown recluse spider bites to major trauma and major injury, and I'll show you some of those. This is one of my classic cases. This is a kid who came to see me, workers' comp injury. He cut the tip of his finger off. Now, if you take your nail, look at the mid portion of your nail, and just think like chopping the fingertip right off there, okay? I saw him 3 hours. This was taken 3 hours after the traumatic amputation. A really, really sweet kid. He caught it in a metal press. You can see where the bone is exposed there, the white piece in the middle, the two digital nerves are exposed. Typically what you would do in a case like this, you take him to surgery, you would cut it back to this joint here, okay, called the DIP joint, and you'd close it, and he'd be on his way. He would have a shortened finger, he'd have a stump, and he'd be able to continue with his life. But he had the opportunity to take this product. And this was, this was three days out. He's pain-free at this point. He's back at work, and he just can't believe it. He said, you know, it scares me every time I change his dressing, but Doc, it doesn't hurt, which was pretty amazing. I mean, he was teaching me a lot as we were going along in this case. He was pain-free. He was doing his dressing changes. The pink tissue on the top is regenerating tissue. See, the bone is still sticking out. Now, I'm not saying you should do this, but if you were in a situation where you couldn't see a physician or you couldn't see a healthcare practitioner, this might be something. You could actually do this yourself if you had enough of this cloth. Okay, and then I have 2 more shots of this case. This was 2 weeks out. You can see it's starting to close. The skin is starting to grow across. Patient's really pleased. You can start to see the outline of what the normal digit might look like as it starts to grow back. And he continued applying the silver-lined cloth. This is what it looks like 39 days out. At this point, he stopped using the cloth. Now, what will happen is enough silver, we're talking microgram level silver, gets into the soft tissues that it will continue to regenerate even after you stop using the product. And then this was his final picture. He came back. I asked him to come back just for a photo. I love this because he's got dirt under his fingernail, which means he's using his finger. He's got a fingerprint back. He doesn't have a disability. His finger's about 10% shorter, okay, if you look at it. He's happy as a lamb. And he said to me, Doc, you're going to make my finger famous. I said, well, I don't know. I still see them. These are my neighbors, okay? I mean, I see them a lot around the community. Okay, a big thing we have is digital neuromas. If you know somebody who's amputated a digit, they'll develop this very hypersensitivity at the end of the stump of the digit. With this product, over 30 amputations, I never had a neuroma be created. And that's because I'm stimulating normal tissue regeneration. Okay, what I do is a cost comparison, and this is for the bean counters. But his treatment by using the office visits, the treatment, the cloth, and myself making a good profit as an orthopedic surgeon, $800. If you'd gone to the hospital, it would have, with a surgical graft, $13,000, and with the disability evaluation was $15,000. So people who are seeking workers' comp disability don't like this product because they won't get as high disability. Now, word of caution. I don't know how to say this politely. You can't shine a fecal lith. You know what a fecal lith is? It's a stool, okay? It's a piece of shit, okay? If something is so destroyed, this product doesn't work. This is not a panacea. This is not a regeneration. This is a product that gives you every possible chance of a good result, but it will not create magic. It's not a miracle. So please understand. Now the FDA. This is one of my favorite subjects because when I started out, this is the way I would look at the FDA. After working with them for 2 years, I have a whole different perspective. I respect them now. They've helped me learn. And these are the types of things you have to do if you want to bring a product like this on the market. This is a series of 6 studies that I had to have done at an independent lab. This is proving the safety and efficacy of this product. Now, each one of those studies is a testimony. Looks at a different body system, a different part of the immune system. This is not an easy process. And then we had to do 4 different antimicrobial studies. Now, I had years and years of experience with this product, but yet I still had to go back to an independent testing lab to prove that this works. This product is safe, this product is effective, and this product does what I say it does. Now, what this product does, it's antimicrobial. We all know that, okay? Silver's antimicrobial. There's no bacterial resistance in wound bacteria. There are some bacteria out there that are resistant to silver, but not bacteria that grow in a wound. This product is non-allergic. You cannot get an allergic reaction to silver. There's never been one reported in the literature. And it also reduces pain. So what I'm asking you all to do with the little piece that I gave you, save it. When you cut yourself, take the product, fold it over 4 times, put it on the wound, and then put a little Band-Aid on top of it. And see what happens in 10 minutes, see what happens in 20, in 2 hours. If you keep it on there for 3 days or 1 day or whatever you think, as long as you want to keep it on, that wound will be healed in half the time with no pain. And it reduces scarring. Okay, when I started out, we were running electricity through silver to run silver off into an area. This is a bacterial culture. This is one of our cloth products. This is a culture of Pseudomonas, one of the primary species that infect wounds, burns primarily. The clear area you see is where it's killed the bacteria. So this bacteria is as thick as a bacteria you'd see in stool. It's about 10 to the 8th, 10 to the 9th. It's very, very concentrated bacteria. The literature, I found 35 species of bacteria and 5 fungal species that silver will kill, and I didn't find any more in the literature. And this is looking about the last 75 years worldwide. In a wound, if you do periodic cultures of a wound, you'll see the bacterial content will go down. When you get down to less than 10, what you do is you enhance the body's wound healing capabilities. The bad actors in our field, these bacteria that are resistant to resistant to antibiotics, one called MRSA, or methicillin-resistant Staph aureus, or vancomycin-resistant Enterococcus faecalis. These are the ones that make the news. These are the bacteria that antibiotics aren't working on because of the overuse of antibiotics. Pseudomonas, there was one case reported, although it was on the silver-sulfadiazine. I have to mention that. There are certain soil bacteria. It's very interesting. There are bacteria that live in the soil that are resistant to silver. You take them out of the soil, put them in a culture, you reduce the silver content for a couple generations, and you inject silver into them, you kill the bacteria. So it's not the same type of resistance that bacteria develop to antibiotics. Okay, how does it work? This is the guts, okay? This is the take-home for y'all. And I'm going to try to make this understandable. How does this product work? It works by 3 mechanisms. It works by a silver ion effect. It works by a transepithelial potential. This is the potential that's on the surface of everybody's body. If I measure the current or the voltage on your skin, I'd measure between -50 and -70 millivolts. When you injure your skin, the voltage drops down to 0. You put this product on, the voltage goes back up. Not to -70, but it goes back up enough that it takes the bias off the nerves and the pain goes away. And the neural epidural junction. Now this is what Bob Becker's theory was. And the transepithelial potential is the newer theory that's probably more correct than Bob's original theory. This is what silver ions do to tissue culture. These are slides of fibroblasts. Fibroblasts don't look like that. They look like these cells with these big pseudopods sticking out. That's a cell in a blastic stage. That's a cell in a regeneration stage. That's a cell in a primitive stage. that cell will divide and make multiple copies of itself. You take the silver ions out, they all revert back to normal cells. So it does create a de-differentiation of cells. Regeneration? Yes, it is regeneration. But they don't like the word regeneration. So we have to say it's a de-differentiated cell back to a primitive state. So silver will do that. This is a piece we took out of a wound. These are all regenerating cells coming from the piece of tissue. The other is the transepithelial potential. That's created by the cells in your skin, which have little pumps called sodium pumps, which create the electrical potential on the surface of your body. What I discovered, if you recreate that electrical potential by putting a material that's highly conductive on the surface, you stimulate wound healing and you take pain away. Now, silver colloids can't do that because they're not conductive. There is not on the market today, there is not a dressing that's conductive. And that's how this product works. We go back and we put the body back into its normal state, what it should be. This was our original idea, that were little nerve endings. And the nerve endings do go into these special cells called Langerhans cells. But they don't maintain the potential. This is a regeneration phenomenon we see in amputated limbs. What maintains the potential in normal skin is the transepidermal potential, or the TEP. Now this was part of my patent, worldwide patent. What we have here is the skin itself acts as a generator. The generator creates a voltage on the surface of the body. You destroy the skin. You just crack a bone underneath it. You destroy a ligament or soft tissue injury, and you're going to alter the surface potential. You recreate that surface potential with a product that's highly conductive. And the body itself will rebalance itself and will create a stimulation for healing. That material you have in your hand, by the way, is it's more conductive than copper wire. Now, what we want to do in wound healing is we want to make that wound. If I have a mammal, a mouse, and I have a frog, that frog's going to heal 10 times faster than that mouse. Amphibians heal faster, period. So if we can make a wound look like give it the environment that an amphibian sees, that is, create the electrical environment the amphibian sees on a mammal, we can create wound healing like what we see in the amphibian, and that's what we're doing. Now, this is a classic trauma. This one next, I have 3 more cases we'll show you, then we'll ask questions. This is a motor vehicle accident, head went through the windshield, a big flap of tissue that's right down to the skull. You have to take this case to the operating room if you want a good result. You clean it up, you do plastic surgical closure. Now, what's interesting about this case is this next picture. The next day, we took her back from the floor to the operating room and rotted her femur. She had a mid-shaft femur fracture. This is what her face looked like the next day when we took her back to surgery. Now, what we were able to do with this product is control the edema. We control the edema, we control all the cascades that occur that create scar tissue. If you can control that, you can control the result of the wound, what the wound's going to look like. So, this is what she looked like about, let's see, this is about 2 months out. The dressing only was on her for 4 days, that's all. So the earlier you get the dressing on, the better your result. And this is what she is like a year out. No plastic surgery, nothing, okay? You can do these things, okay? Even if I had the very best possible surgical technique, I couldn't have gotten this result, okay? But you can get this result when her head, if I measured the potentials on her forehead, it would have been so mixed up, so discombobulated that there would be no continuity. By putting this cloth on, you basically smooth out the field. Now, for the people who are clairvoyant, if you put this, if you see a large ulcer on a leg, and what you'll do is you'll see the energetic field come down and suck right into the leg. Well, you find the same thing when you measure the potential on the surface of the wound. You put a highly conductive material on the wound surface, and the field starts to level out. And what you do is you trick the brain into thinking the area is normal. If the brain thinks it's normal, you heal faster. That's a fact. And there's some wonderful studies to show that. Okay, and I did some cost comparisons. We're going to move fast through this. There's significant cost savings with this type of technique. No tattooing of the skin, very little post-op pain, and minimal scarring. Okay, conductivity is the issue. Silver is the most conductive material in the world. Again, that's why colloids won't work for this because they're not conductive. Now, if I took a square sheet of, say, a 1 square foot piece of silver, and I took 1 square foot of that cloth, the cloth that you have, it's about 10 times the surface area. If I then take another cloth that we're developing, it's about 25 times the surface area. So think of it as 25 layers of silver that we're able to stick on the wound to have contact with the body. Okay, very briefly, we're going to go through this fast. This is just the silver plating techniques. I want you to see what the fabric looks like. This is one of the fabrics. The fabric, and this, what will happen, this is 25 years old, this fabric. That fabric was fabric that we used in the 1976, 1975 studies that were published in Becker's work. The product has an infinite shelf life. This is what you have. This is what your product, this is called a jersey knit pattern. Okay. If you take it and put it into 4 layers, you increase your surface area significantly. This is what a cut end of the 4 layers looks like. And this is what a fiber looks like. This is another warp knit, another style we use for different types of wounds. This is a pure fiber. Okay, that's pure nylon. And then we're dealing with a 4 100,000ths of an inch, or 0.4 micron thick, coating the silver. But the silver is totally coated on the product. That's how it works. We have a huge surface area with a very thin layer of silver, and this is all presented to the wound fluids that's highly conductive. That's like a wire. That's how it works. And this is what the silver, it's an autocatalytic process. If I had 1,000 surface polymer chemists in this room, about 25 would know how to, and this is relative, okay? 25 would know how to put metals onto polymers. Of the 25 that know how to put metals onto polymers, 2 or 1 would know how to put metals onto fabrics. Putting metals onto fabrics is an art. It's not easily reproduced. So I don't have any fear of someone coming in and taking this technology away. Now, we proved it by these studies. We did electron microscopy, which you saw some of the pictures there. We did an X-ray spectroscopy to show us the purity of the material. And we did thermal gravimetric analysis to show us we had no impurities on the surface of the material. This will be the last case, and we'll have questions. This was the first case that you saw. This was a 2-year-old child that came to see me with a burn half an hour after it's injured its leg. Child was in extreme pain, screaming. If you all have been with a very severely injured child under 7, the screams will cut your heart in half. It's terrible. What made my whole experience of developing this product were these types of cases. You put the product on, the child was sound asleep in half an hour. Children don't lie. And we went on and changed the dressing, and we had to do some debridement. You can see the leg, the dead skin there that was sloughing off. Okay. Every time she came back to see me, she never cried once. She totally let go of her fear, because she knew this dressing at one level was not going to create pain for her. Okay. This is what it looked like. I had her come back in a year, took these photographs. She was walking in 2 days on this foot, on this leg. Now, you'll have the product, and you could do this. I'm not saying you should do this, because these are cases that you've got to watch carefully, because you have to make sure you keep taking the dead skin off as it comes. But these are cases that are handled on an outpatient basis. They don't need surgery. They don't need antibiotics. They can be handled on a topical basis. 6-month follow-up, sorry. Let's see. Oh, and animals, by the way, they love this material. Put this on an animal, the animal won't know they had a lesion. We've done this on horses and dogs, particularly lick granulomas in dogs and trauma in dogs and rope burns in horses and pyogenic granulomas or proud flesh in horses. Works extremely well. The hardest thing on a horse is figuring out how to keep the dressing on. But if you can figure out how to keep it on the animal, you'll take away the neural input. The animal won't know they have a lesion. And see, a lick granuloma in a dog, the dog keeps licking it. Well, if you put this product on, it takes out the nervous input to the animal's central nervous system, and the animal doesn't know they have a lesion, and they'll go in their normal life. It works very, very well. One last case. This is a personal case. This was my wife's first husband who never supported my 2 teenage daughters who, he was a ne'er-do-well, terrible protoplasm, a smoker, drinker, into all kinds of things. Didn't want to spend the money that plastic surgery required, so he called me up. He lived about 5 hours away, begged to come down. I took him as a patient. The best thing he's done for my wife and my stepchildren, my family, was to hurt himself like this, because he gave me this series of pictures. So we still get along, but you know, that's karma. You know, you treat everybody regardless of what they did to you. This was a couple months out, and all he did was change the dressing every day. He just had to take out the dead bone, and this is the final result. You know, he has scar tissue there, but he has a foot that's functional, and he basically, I don't even know if he paid me, but that's irrelevant. Let's see, I think one more. Cost comparisons. He saved a lot of money because he would have taken a lot of surgery to have taken him. Reduced swelling, less pain, and again, okay, one last statement. This is a product that's totally antimicrobial, no bacterial resistance. It'll reduce pain, it enhances wound healing, and reduce scarring. Okay, toxicology. What's a toxic dose of silver? The RFD, this is a dose you take every day for your entire life. If you take this amount of silver every day for your entire life, you won't become toxic. This was what the government had said, and it's 5 micrograms per kilogram per day, which comes out to a 70-kilogram man about 300 micrograms, which over a lifetime comes out about 10 grams of silver. So there's no way you're going to get toxic. This is our website. We have some more information on it. You can get product through the website. These are the products we're selling today, primarily just the wound contact dressing. The adhesive strips are coming shortly. And this is the future. We're coming up with these products for everything from teddies, bras, island pads, wound closure strips, island dressings. An island dressing is a pad with a sea of tape around it. And we're also going to do some interesting experiment. The next phase is we're going to alter and we're going to put, in an experimental basis, holographic imaging on the plating as the plating's done. So we're going to add some really interesting technology to the plating technology, which we think will translate to a better final product. Now, this works from everything from diabetes to major injuries. And one last slide. Thanks. Questions?
Well, are we live over here? Why don't I just ask what's on everybody's lips? Bart, what will be the price of them? Can anybody get them? Are they going to be in kits or first aid kits or something like that for the individual user? I know you'll have institutional use, but what people would like to know is how can we get some, and what do they do next?
Yeah, we're starting out with, we're just putting on the market the material alone, not configured into a dressing formation. A strip that's piece of material that's 4 inches wide and 9 feet long. We're selling for $40 retail. Half of that we're selling for $20, and a fourth of that we're selling for $10. Now, a long strip of this material would probably last a family a year with lots of cuts and scrapes. I mean, can you consider what the surface area of a Band-Aid is? Like 1 inch square or 1 inch by 3 inches. You know, 4 by 108 inches will go a long ways. So it's, and the product itself will continually be sterile too. So you can open it, cut a piece off, put it back in the bag, and keep it forever. If you're a hiker, high altitude climber, if you're back in the woods, you can just throw the little pack into a pack sack, and then with a knife or pair of scissors, cut a piece, put on the wound, and you know that's going to stay sterile. The Band-Aid, one last question, the Band-Aids that are going to come out are going to be equal in price to the J&J Band-Aids, the antibiotic J&J Band-Aids. Same price structure.
Can't you wash them and reuse them?
Well, let me go over that. In India, where I do volunteer work, we'll take the heavier duty material, we'll wash it, patient will come back to the clinic, we'll take the dressing off, wash the silver part of it, put it back in the wound in a new pad, and we'll do that for 7 to 10 days. You can't recommend that in the States. Okay, that would be a no-no with the FDA. But in a pinch, you could do that if you had to. Yes?
Yes, I'm a registered nurse. I work with a clinic of doctors. Could I get some printed information or
Absolutely.
copies of studies
Absolutely.
to take back with
I have
them?
many levels of complexity of material and information
Where would that be?
on the website. Use that website, and then I'll be happy to talk to any of the physicians or any of the nurses who want to use the product. We decided not to launch. We'll be launching into the professional side next year.
What about the handouts you got? I got here late.
It's what?
The handouts that you gave.
Any
Do you
left?
Have more of those?
No left. Oh, okay. Just give me an address. I'll send it to you
Great.
afterwards.
Thank you.
Yeah. Oh, I'm sorry. If anybody wants a handout, just give me their address and we'll send it to you.
I have 2 questions. When you pull off the old dressing, does it help debride the area?
It does. The dressing has a quasi-stick capability to it. If you keep the dressing on for 3-4 days, it won't stick. If you keep it on for 1 day, the dried blood will sometimes stick. You just put a little water on it, it comes off. The wounds are self-debriding, although it does help it along if you'll take the dead tissue off or just rinse it off with water.
Okay. And then have you used them on decubitus ulcers?
A lot. Very effective. Again, it won't, if you have a lot of dead tissue, you still have to debride the dead tissue. But a lot of my clinical cases were decubitus ulcers. But I saw the stage 3s and 4s, the big holes. I didn't see the nice 2s and 3s and 1s. Yes?
Will this product work on old scar tissue?
If you'll combine it with silicone sheets, yes. I've had one case I remember of a hernia operation that was 3 weeks out. Person still had a lot of incisional scar pain. Product took all the pain away. If you have scar tissue, you have to combine it with silicone. So the answer, you have to be extremely patient and take a long amount of time to alter a scar after it's set into its pattern.
Did I hear you correctly that you need to fold the product 4 times, so you need 4 layers of
You would
the
like to have
product?
4 layers. Now, the product that you have is 4 times the density of silver, so that we just put it in to fill the hole, that's all.
I have a finger similar to the one in your picture,
Okay?
and they did pretty much exactly what you said they normally do.
Yes.
And I'm assuming there isn't a whole lot that this technology could do for a finger at this point in time.
That's correct. But remember, this is hopefully just the start.
This is what?
Just the start.
Just the start.
The start, okay? Well, there's a lot we have to learn, but we have to start someplace, and this is where we're starting.
Okay, what about a closed wound, something like a broken bone?
Yeah. The bone itself will knit faster. That's been my clinical experience in X-ray radiographic, although I haven't published those results. Remember, in a fracture, very briefly, in a broken bone, what you have is an altered skin potential. So if we put a highly conductive material on the surface of the body, we alter that, we bring that potential back to normal. And we bring it back to normal, we speed healing.
Okay, thank you.
Yeah.
I'm curious as to why colloidal silver applied to the skin will not work.
It works, but it's not conductive. And the problem is it gets washed out quite rapidly by the body. You want a silver product that gives you continuous release of silver over a period of time.
Okay, what if you had a metal plate, a silver plate applied to the skin and with a little bit of
A silver
current?
plate would work, but remember, we want something 25 times more surface area. That's why we went to a cloth.
Have you treated any bone injuries that had cancer in the bone?
No.
No.
But, cancer is a different situation. It's out of my league at this point. Yes.
What is your website?
Silverlawn, www.silverlawn, Silverlon, S-I-L-V-E-R, it's like silver, L-O-N.com.
Have you used it to grow cartilage back?
Not specifically, but let me give you an example. If, let's say you have a knee, a cartilage lost in a knee, and knee is much easier. The body does try to heal itself. That's what a bone spur is. A bone spur is an attempt of regeneration, but in the wrong spot. What you'll notice is that, yeah, okay, time's up. I'll answer this one question and finish. What you notice is, in severe osteoarthritic knees, or where cartilage has been damaged, you'll have an altered surface potential. If you can keep the knee wrapped like every night in this product, you will have a reduction in pain. Okay, thank you.
As Mel Allen would say, how about that? Isn't that an exciting 15 or 20 years of work that he's revealing here today? He does not feel it feasible to offer a workshop, but he will be here to talk to you, I think, until tomorrow. So, be back in 7 minutes. We got 2 more new items that came up since the program was printed that I think you'll find most interesting and probably very exciting. Okay, give us about, where are we doing? How are we doing with our scheduling? Is it 3:45? Oh, he did, okay. Let's give him about 6 minutes here. And then tell me in about 4.